Hello and welcome to our webinar entitled 2021 Advice for the Ophthalmology Resident Match Season. My name is Roxana Mirza and I'm the Director of the Undergraduate Medical Education in Ophthalmology at the Feinberg School of Medicine. I also serve on the SF Match Oversight Committee. I'm very excited to be moderating this webinar, and I'm going to start with the goal of this meeting. The goal of this 90-minute webinar is to provide the latest information about this year's match season. We have assembled a panel of dedicated educators in conjunction with the Association of University Professors of Ophthalmology and the American Academy of Ophthalmology. We are a diverse group representing these organizations as well as the SF Match. We hold a variety of roles within these organizations and within our own departments. We will give you the perspective of department chairs, medical student and resident educators in ophthalmology, as well as the dean's office. We will share guidance about applying for this year's ophthalmology residency match and point out new features of this year's match. Presenters will cover tips related to personal statements, rotations, letters of recommendation, virtual interviews, assessing residency program fit, integrated internships, and more. We recognize the uncertainty that the past year has brought to our applicants. We assure you that we are here working to address the needs of our applicants and disseminate the information to all students. Some of these processes are a work in progress. You will receive a handout of useful resources, and this session will be recorded and posted on both the AAO and the AUPO websites. This is an overview of the topics that will be discussed tonight. I'd like to now introduce my co-moderator, Dr. Prithvi Sankar.
Hi, everyone, and it's great to be co-moderating this session with Dr. Mirza. My name is Prithvi Sankar, and I am the Director for Medical Student Education at the Shea Eye Institute at the University of Pennsylvania. I also am an advisor dean for the Perelman School of Medicine and the senior advisor to the graduating class at the Perelman School of Medicine as well. And I'm happy to also co-moderate the Q&A session with Dr. Anju Goyal, who's going to be introduced now.
Hi, everyone. I'm glad you're here today. I am Dr. Anju Goyal. I am the Director for Medical Student Education at Kresge Eye Institute, Wayne State University in Detroit, Michigan. And I just want to wish you all a warm welcome, and I'm glad you're all here today. Thank you.
Great. Just a few housekeeping items. Just to remember that you can certainly ask questions and you can put them in the Q&A section of the platform, and we'll be moderating the Q&A section. All of us will be kind of pitching in. If there are questions that we can answer, we'll answer them there. Otherwise, we'll try to answer them live. I'll apologize in advance in case we can't get to all the questions, but we'll do our best as we can.
Great. Before we move on, we would like to poll our audience to see who we have on this call. There will be two questions. Please remember to scroll down to get both questions. We'll give you a few minutes here. All right. We have almost everyone who has voted. The majority on this webinar are 69% are medical students, but we also have, medical students who are fourth years. We also have third years and second years, and 1% are first years. We have 6% international medical graduates and 8% practicing ophthalmologists. As far as our geographic locations, they're quite spread out, 27% from the Midwest, 32% from the Northeast, 8% from the South, 18% from the Southeast, and 4% from the Southwest, 7% from Western United States, and we have 3% of international individuals on this call. All right. Next, we're going to move into why would you choose ophthalmology? And I'm going to turn it over to Dr. Sankar to introduce our panels, and they will discuss why they chose ophthalmology.
Thank you, Dr. Mirza. As you can see, we have a lot of folks who've been really interested in teaching medical students and trying to advise the next generation of medical students to come into ophthalmology. So I'd like to have a chance to for them to introduce themselves, and we'll kick it off with Dr. Keith Carter.
Greetings, and thank you for joining us this evening. My name is Keith Carter. I'm chairman of the Department of Ophthalmology at the University of Iowa. I have a background of 14 years as a program director and 15 years as a chairman. And so with that history, I've sat in a lot of interviews. Why ophthalmology? At the time, the technology was interesting to me, and the eye lent itself for complete examination. I need things very simple.
Wonderful. That's great. Dr. David Quillen.
Good evening, everybody. I'm glad to be here and I look forward to our interaction. My name is David Quillen. I'm the Blankenship Professor and Chair at Penn State College of Medicine. I've been in ophthalmology education for 26 years and just love everything about it. And I guess why ophthalmology? I really love the people that we get to work with and the patients that we get to serve.
Excellent. Dr. Lisa Kelly.
Good evening, everyone. I'm so excited to be here with you this evening. I'm Lisa Kelly. I'm the Taylor Asbury Professor of Ophthalmology and Director of Medical Student Education at the University of Cincinnati. And why ophthalmology? It was just such a wonderful blend of being able to take care of patients surgically and also being able to take care of them medically over the decades.
Fantastic. Dr. Janice Law.
Hi, Janice Law here. I'm the Director of Medical Student Education and the Vice Chair for Education at Vanderbilt Eye Institute in Nashville. I'm also a vitreoretinal surgeon. And why ophthalmology for me? I really love empowering the lives of my patients, giving them opportunities to live their life to the fullest, and the retina surgeries are really cool.
That's wonderful. And glaucoma specialists are pretty cool too. I agree with that, with all of this. Dr. Chris Alabiad.
Hi, good evening, everyone. I'm Chris Alabiad, and I am the Assistant Dean for Student Affairs at the University of Miami Miller School of Medicine. And I also am the Residency Program Director at the Bascom Palmer Eye Institute. And why ophthalmology for me? I just love the wide breadth of pathology and the fact that I can care for patients from age 0 to over 100.
Wonderful. Dr. Jeff Petty.
Hello, my name is Jeff Petty. I'm the Vice Chair of Education and Residency Program Director at the Moran Eye Center in Salt Lake City. Why ophthalmology? So many reasons, but it did open doors to impacting global health and global ophthalmology.
Excellent. Dr. Misha Saeed.
Hi, everyone. So glad to be here tonight. I am a professor of ophthalmology at the University of Texas Medical Branch in Galveston, and I also have pertinent roles as program director of our residency program and also serve on the Program Directors Council and the SF Match Oversight Committee. Oh, and why ophthalmology? Initially, what drew me was actually the people here on this panel, just the wonderful people I met when I was looking into the field. And what really kept me there is I love treating the macro and the micro of patients.
Fantastic. And Dr. Michael Siatowski.
Thank you all for being here. My name is Mike Sikowski. I'm the Residency Program Director and the Chair of the Department of Ophthalmology at the University of Oklahoma and the Dean McGee Eye Institute. You're entering a great field. It's fun, it's interesting, you have cool instruments, cool surgery, grateful patients, you can do amazing things, and you will work with some of the most content, intelligent, and amazing people of your career. Congratulations.
Wonderful. Thank you to our panelists, and we're really looking forward to all the great information that you're going to be giving to us. Now that the panelists have introduced themselves, I think we should switch to what you should do next. And you can't understand what to do next unless you have a timeline in order to do that. And Dr. Mirza is going to walk us through the timeline.
Great. Thank you, Dr. Sankar. So first things first, you all have registered for the SF match. So that happened on July 1st, the match opened. And you may be familiar with this, this graphic, and I'm going to talk you through the most salient points of this. So July 1st, application registration portal opened. So now what? So September 1st, the completed applications will be released to the programs. Applications will continue to be sent to programs on a rolling basis. There's not a firm deadline to submit an application, but individual programs may have their own deadline. So it is you are responsible for knowing those. October 18th, programs will begin to extend invitations to interview. Individuals will be able to accept a maximum of 18 interviews. November 1st, interviews will begin. All interviews will be virtual this year. January 7th, the final day of interviews. January 12th, program deadline to submit rank lists. This is an important deadline because after this deadline, you will have the opportunity for an optional live program. All of these components will be discussed in a few minutes. And then the following are there. So the last day for live program interviews are January 25th, and the applicant will deadline to submit rank lists will be February 1st. Match day is February 8th. There are some other important points to note. This year, the personal statement has been changed. In order to increase diversity within our profession and to obtain a more holistic review of the applicants, the former one-page personal statement has been replaced. There's a 500-word autobiographical sketch, and the application will contain a list of several short essay questions, and you'll have to choose 2 of them. They are 250 words each. Again, this will be discussed later in our webinar further. Please also be aware that some ophthalmology residency programs may be evaluating holistic assessment tools as a part of a voluntary pilot for an upcoming application cycle, and that at this time, these tools are not endorsed or approved or required by the AUPO, the AAO, or the SF Match. If you choose to apply to one of these programs that is participating, you will receive further information at the time of your application. The demographic portion of the portal will also query gender identification to understand diversity within our profession. These questions are completely optional, and the answers will be not provided to the programs, but will be used for demographic purposes by the SF Match. That's all I have. And next we will be moving on to Dr. Carter.
Hi, I'm going to talk to you about your personal statement. I know it's changing, but the background of what you need to do is going to be the same. You're going to have to talk about you. And I know sometimes it's hard to talk about yourself, but you just can't do that in one sitting. You need to sit down and start writing down things you want to include in your personal statement. And the most important message is, when I read that, why would you be an excellent resident physician? And the way you're going to tell me that, you're going to tell me your story, your journey, not anyone else's, your journey. What made you do the things you want to do? What influences your family had on you? What are your family members doing? Who teachers that influenced you, mentors, etc. And what exciting things in your life has made you the person you are? That's very important to distinguish yourself from other people that are applying with you. Remember, it's your journey. Take time to think about your journey, and do not do the following. Don't describe why the field is interesting. We know that. Okay, don't waste your lines on that. Don't use cliche phrases that are likely overused. One of them, per se, is how you got a pair of glasses when you were in high school and then opened your eyes to ophthalmology. Don't highlight qualities that the committee may question your suitability as a resident. There's no need to bring that up. That can be a positive for you. So if you think it's important, I would recommend you speak to an advisor about this. Next slide. If you have a noticeable gap in your application, time off for medical or academic reasons, academic probation, a low step 1 score, this should be addressed in your personal statement, okay? But it's your personal decision. If you think you can explain it in a way that lends credibility to why this event happened, then include it. The committee will know about it. So if you want to answer it, or you can wait till your interview and answer it. But remember, the personal statement application is going to get you the interview. So you got to line up your timing correct. Revise your statement frequently and ask your mentors, the people you trust, to review it. Okay, this is very important. That this is your most important statement. So go over it, read it frequently, and ask other people to read it, because you're going to get tired of reading it. And very important, don't misspell ophthalmology. If there's one thing you can do to bring attention to the committee and laughs and jokes, is you misspell ophthalmology. okay? Please don't do it. You will hear later that the AUPO is changing the personal statement format. It's going to a short autobiographic statement, short answer questions, and details will follow during this presentation. But these guidelines that I gave you are still going to be relevant because as you prepare for the match, you have to define your story, which is critical for your interview as well. Thank you.
Next, we will go into Dr. Quillen's talk.
Okay, thank you. This is a follow-up to Dr. Carter's discussion. If you could go to the next slide. So this refers to some of the things that he mentioned in terms of personal statement comments. You know, the first one is the epiphany in 3rd grade that someone knew they wanted to commit their life to ophthalmology. The second one is describing the virtues of ophthalmology and why you're choosing that profession. And then the third one is, of course, the dreaded misspelling of ophthalmology. It's definitely one of those things you want to be very sensitive about when you put your application together. Next slide, please. So as Roxana mentioned, we're changing the application a bit this year. And one of the things is we're changing the personal statement into a couple different categories. Why? Well, from the applicant's perspective, the personal statement does serve a very important function. It's an opportunity to highlight characteristics that may not be covered in the other aspects of the application. But I think most of us consider it a very challenging and even dreaded thing to go for. I know some of our students will say, how can I repurpose my medical school personal statement to make it appropriate for ophthalmology residency? And the reality is, over the past, it's been very ambiguous in terms of what is desired. As Dr. Carter mentioned, it may be an opportunity to highlight personal characteristics. You may describe life experiences that affected your career choice. People often will talk about the benefits of ophthalmology or the qualities of ophthalmology that draw them. And then finally, people talk about career aspirations. And it's always funny from our perspective, probably the majority of applicants will talk about academic ophthalmology and their desire to pursue a career in academic ophthalmology, although only about 2 or 3% of people actually do pursue academic careers. Go ahead to the next slide, please. From the reviewer's perspective, it's a little bit more controversial in a way. Even among our match oversight committee, there were varying responses as to the value. One of the members said they just very briefly review the personal statement. Another committee member said it was the most important aspect of the application. When ophthalmology residency programs were asked to describe the impact of the personal statement, it kind of fell in the bottom third of characteristics that people thought were important in terms of developing into a good resident. There's a high prevalence of common themes, so it's really hard to differentiate candidates. People review them very differently, so depending on what your interest may be. I'm a clinician educator at heart, so if I see someone writing about education, that kind of tweaks my interest, whereas someone who's an intense researcher may look at that as negative. And there's also some research that shows that personal statements may be able to contribute to implicit bias and gender disparities. So next slide, please. So this year, the Match Oversight Committee made a change, a recommendation to the board, which was accepted, to change the personal statement. As Roxana mentioned, our main goal is to enhance diversity and inclusivity within ophthalmology, to ensure a fair and equitable application process, and then to promote and also facilitate the holistic review of applicants. And so we're replacing the personal statement with an autobiographical sketch and then some short essay questions. And I think a big part of this change is to focus the applicants and allow the programs to focus on the candidates. Next slide, please. So what's new for 2021? The autobiographical sketch. This, as Roxana mentioned, this is a 500-word process. The autobiographical sketch makes it pretty clear as to where the focus is. This is not the time to focus on the benefits of ophthalmology. It's really a chance to share your story, or as Dr. Carter mentioned, your journey and why you think you're a qualified applicant. It's really a great opportunity to highlight background, personal characteristics, differentiating qualities or experiences that you believe distinguish you as an applicant. The short answer or short essay questions is another aspect. These will be 2 questions selected from multiple questions. Now, there'll probably be 5 or less questions that applicants will have the opportunity to select 2 from. There are 250 words limitations. And again, this will provide a very targeted thing for applicants to answer. And it also allows programs to compare applicants and look at them a little differently as opposed to just this broad personal statement. Next slide, please. Now, just as would occurred last year, there are some customization options. Applicants will have the ability to customize their autobiographical sketch for individual residency programs. Now, this, you may have specific interest in select programs, and so you'll be able to address that within your autobiographical sketch. We don't recommend that applicants do an individual autobiographical sketch for every program they apply to, but this may be an opportunity to what's being referred to as preference signaling, where you can show a program that you have a specific interest in that program and why that may be the case. The other thing is, because of the technical aspects of the application, applicants will be able to select multiple short answer questions if they so desired. We really don't think people are going to take advantage of this technology. The assumption is that applicants will answer 2 of the questions and then they'll submit those answers to all the programs that they apply to. Next slide. That's the end of my talk. Thanks for your attention and best wishes for a successful ophthalmology match.
Great, thank you so much. I think we do have a little opportunity to discuss this first phase of the webinar, the journey and the personal statement. I'd invite Dr. Sankar, do you have any questions related?
That's a great question. A lot of people have been asking about the essentially the difference between a personal statement and the autobiographical sketch, and in terms of not only the length, but the content, how much to sort of put in there. So that's been, we've been seeing a lot of those questions come up.
Yeah, I love the way Dr. Carter talks about your journey and your pathway to this point in your professional careers. And the autobiographical sketch is pretty much what it sounds like. It's really an opportunity to focus on you and your experiences, your qualities that you think make you an outstanding candidate. It really is designed by intent to focus on that. So in many ways, it's a mini personal statement, but the focus is on you and not of these other things that Dr. Carter mentioned.
One thing that I would just highlight as well in Dr. Carter's talk, that journey, that reflection that he kind of described so well, really kind of helps you set that autobiographical statement. It also helps you throughout the match season to helps you with your interviews, helps you with your mindset. Dr. Carter, did you want to expand on that a little bit?
Yeah, I mean, because in the interview process, people want to hear about you. They have your transcripts, they have your board scores, they have a lot of information that you don't need to rehash with us. So it's an opportunity for you to tell the story that makes you different than the other person. I ask people all the time, I say, I have 20 people I'm interviewing today. Tell me why I'm gonna remember you at the end of the day when I'm gonna rank people. And boy, a lot of people are not prepared for that. They haven't even thought about it. And I just think you need to prepare for this interview because it's very important. And I think if you have gone over what your journey is, it gives you plenty to talk about. It doesn't have to be sort of cliche in your answers. It gives you something unique that I think is special.
All right, Dr. Sankar, do we have any other relevant questions at present, or should we continue on?
We can continue on for now, and we'll catch up on the rest of those as we're going through.
Okay, excellent. Our next talk moves into the Ophthalmology Away elective by Dr. Lisa Kelly.
Good evening, everyone. Away electives are an excellent way to increase your exposure to ophthalmology. This evening, I'm going to discuss how to maximize your experience if you choose to do an away. Next slide. So first, what is an away elective? Let me be clear that it is not necessary to do an away elective in order to be successful in the ophthalmology match. Away electives are typically done in your M4 year at a place other than your home institution, and the applications are via the VSAS program of the AAMC. And as many of you know, this year, due to COVID restrictions, students are limited to one away elective. Information about virtual electives are also available on the VSAS website, but in the interest of time, I'm not going to go into detail about virtual electives in this discussion. Next slide. Dr. Mirza has been discussing the match timeline, but it's also important to understand the VSAS timeline. It's best to start investigating your options for away electives in the winter of your M3 year, to submit your application during the spring of your M3 year, and to plan to attend your away elective during the late summer or early fall of your M4 year. Next slide, please. There are significant benefits to doing an away elective, and those benefits include exposure to new ophthalmology learning environments, the opportunity to work with a valued mentor, the opportunity to concentrate on a topic of interest to you in ophthalmology, and also the opportunity to increase your chances of being offered a residency interview. But please bear in mind that doing an away elective is not a requirement to match at a program, and doing an away elective does not guarantee you a residency interview invitation at that program. There are also a few downsides to doing an away elective that it's important to keep in mind. First, it can be expensive. Second, there's an opportunity cost, and that means when you're at another institution, you can't do something at your own home institution. And schools have different academic calendars. You'll need to coordinate that. And last but not least, you may not get accepted to your first choice of away program. Next slide. Okay, so where is the best place to do an away elective and how do you decide where to go? I would first recommend that you consult with your mentor or mentors. They often have an opinion about which programs would be appropriate choices for you. Also, seek the advice of older students and residents. They've had to make similar decisions very recently. Consider the geographic locations that you plan to apply to for residency. And also consider locations where you'll have social support, such as housing and transportation. Keep in mind that programs have different clinical strengths and choose those that are in the areas that you are interested in. And lastly, you may want to consult various websites such as Texas Star or Doximity to get more general and independent information about various programs. Next slide. So what are the things that you need to know in order to ace your application process? First and foremost, study the VSAS website and understand the program and the process in detail. Next, as you narrow the scope of the programs that you are considering, visit the website to get additional information at those various programs. And start your process early in your M3 year, if possible. Stay organized. And consider having even a spreadsheet to keep track of all of the information about various programs. Know which immunizations and screening tests are required for various programs. I've seen that trip students up as they go to make their VSAS arrangements. And then lastly, keep in mind your social support for various locations. Next slide, please. So perhaps the most important thing is when you do a away elective, it's very important to put your best foot forward, particularly if you are hoping to gain an interview invitation. In order to do that, it's essential that you learn as much as possible about the program. And by that, I mean, know the faculty that you'll be working with. Read the syllabus, know what will be expected of you when you are a student on the away elective, and have a support system in place. It's very difficult to make a great impression if you're very disorganized and disoriented in your personal life. Make sure that your clinical skills are polished, practice your presentation skills, and review your fund of knowledge. And I'm sure I don't have to say this, but it's just a general reminder, make sure that you're pleasant to everyone that you interact with during your away elective. Next slide, please. Lastly, I would encourage you to reap the benefits long-term of doing away elective. You can maximize your return by letting the faculty and residents know of your interest in their away elective residency program. Send thank you notes and follow-up emails after your away elective to let key faculty know that you appreciated the energy that they put into teaching you and the opportunity to work with them. And stay connected by way of research projects or other opportunities. This is an opportunity for you to enhance your professional network and to identify potential mentors going forward. So next slide, please. A few takeaways. Consider doing an away elective early in your medical school career. Mid M3 is not too early. Study the BSOS process and know it well. Reflect on your own personal goals and objectives for doing an away elective. What's right for another student might not be right for you, and optimize your application. Be prepared to do an outstanding job during your away elective. Next slide, I've included a few references that may be useful to you as you are doing your planning for your away elective. All the best to you during this application season, and thank you for your attention.
Thank you for the excellent talk, Dr. Kelly. I also imagine many of those tips are useful for your home clerkships as well. So thank you for outlining those tips on being an excellent student. We'll move on to our next talk, which is identifying mentors for letters of recommendation and what is a good letter. This next speaker is Dr. Janice Law.
Thanks. Good evening. So great to see this large turnout tonight. I've heard a lot of great pearls already. First slide, please. Let's start with what's in a good letter. Letter writers often start with how they know you and how long they've known you for and why they're fit to speak on your behalf. Good letters will highlight some achievements, but hopefully not regurgitate them directly as a list. A good letter uses specific examples to support your professional attributes, abilities, and personality. Community reviewers are looking for non-cookie cutter letters that are personalized and will help us get to know you well. Next. When it's time to identify a mentor for letter writing, you should ask yourself which faculty or mentor has seen or interacted with me in these domains, where I've demonstrated good clinical reasoning skills, how I function on a patient care team, and how I have demonstrated analytical skills in writing, possibly through research or from other methods. Next. Ask yourself, who has witnessed my other skill sets such as leadership or service? Who has witnessed my communication style, my communication skills, integrity, and professionalism? Next. And finally, take a moment to write down your personal strengths. Share these with your mentor who can add their observations to your list. This exercise helps break the ice and build conversation about who you are, your goals, and what to include in your application. Now, for the junior students listening in tonight, these relationships are not developed in the summer of the application cycle. They start early and require investment. I believe the moment you enter medical school doors, you should be seeking out mentors early on, even if it's in a different field. Remember, only one letter is required to be from an ophthalmologist, and we'd rather know more about you through a non-ophthalmologist than to have a letter in your application that might be less personal. And that means that you should also not choose writers based on their title or rank alone. If the letter reflects that they don't know you very well, it will not carry the weight you had hoped, unless it's, of course, Keith Carter, Chair Extraordinaire of Iowa. His letter will always carry you very far. Next. And now for the ask. Take a formal professional approach. Initiate in person or email, depending on your relationship, and follow up the ask with an email and include your appreciation. It's really important to let people know your intentions early. This means even before a rotation even starts, or as soon as it has started. Avoid that awkwardness of trying to chase someone down months after the rotation is over when they've seen 25 students after you. While on the rotation, you could even ask, what does it take to be able to receive a strong letter of support while I'm on this rotation? They could outline goals for you that you can now achieve since they've been articulated. And it does them a favor too, because they are now looking out for opportunities to write about in your letter. Ask mentors when their memories of you are fresh. Ask even if you won't need the letter, even if it's a year from now. You should give letter writers a professional courtesy of 4 to 6 weeks to write and include a specific deadline date so there's no guessing. Don't forget, many faculty are out during summer months, so plan ahead. Next. Set up one-on-one meetings with your mentor to take a deeper dive into your CV, your personal journey, as Dr. Carter mentioned, and to explain specific scenarios or discuss your concerns. Email them documents ahead of time, your updated professional CV, a nearly finished autobiography, and for a nice touch, add a professional headshot, just to show that you have the complete package ready. Then in the email, ask if they need anything else. Sometimes they ask for a transcript, maybe a copy of a drafted manuscript, for example. Next. And then after the meeting, follow through with an email with the submission details, a short summary of your discussion, and a thank you. Make their job as easy as possible to submit a letter on your behalf. Next. Not all mentors have the bandwidth to write letters, and also some may feel that they can write you a good letter, but not the strongest letter that you need. Give them an opportunity to say no. It will be okay, because you need the strongest support possible. If they're willing to write contingent on getting to know you more, be proactive. Use that opportunity. Ask to create opportunities before the deadline. And what if they ask you to draft your own letter? I actually would find that very hard to do as a student. So I put that point up here just to learn from the other expert panelists here how to address this scenario. Maybe they can put that in the chat, their thoughts. If you did great on the rotation but worked only with residents and fellows, ask them if they would send comments to fill in any holes that your letter writers may need, and let the faculty writers know that in advance. And lastly, how do you address the situations of reapplying, probation, remediation, or personal professional hardships? This is fairly common concern. The biggest tip I have is to be honest in sharing these issues with your mentors upfront. That is, this is what we're looking for in our trainees, nothing less than high integrity and transparency. So your letter writer can find a way to incorporate it appropriately. Next. If you're feeling time is running out and this pandemic didn't help, don't despair. Here are a few other ideas to enhance relationships and deepen interactions. Think outside the box. Look for virtual mentoring opportunities for different organizations. Also, as you finish writing up your research or case reports, branch off and ask for more responsibilities and come up with your own new initiatives. Write an iWiki article that has not yet been done before. And consider inviting your mentors to a community service event, fundraisers, health screening, eye screening events, or other things that will allow them to see you in leadership and service roles or other ways that you can demonstrate your passion. Next. So this is my final slide. Mentees should screenshot this. I want everyone to understand that being a mentee isn't just receiving. Being a mentee actually requires action on your part and a role to play to help the relationship be successful. Next. Thank you and good luck.
Thank you so much, Dr. Law. That was fantastic. I feel like I've learned so much. Those writing the letter for yourself, I think that also goes back to the journey that we were talking. All these exercises are really valuable in assessing your own strengths, but definitely tricky to do. All right, our next talk is from Chris Alabiad, Dr. Chris Alabiad from the Bascom Palmer Eye Institute, and he's going to talk about advice from the Dean's Office.
Good evening, everyone, and thanks for the invitation, Roxana and Prithvi. I actually also am going to have a hard time following Dr. Law's amazing talk with high energy and all the other speakers as well. But I'm going to give some advice from the Dean's Office right now. And even though 69% of you are fourth-year med students, I think it's important for the others that are first, second, and third years to ask themselves the question, is ophthalmology the right career for me? And I often get medical students at various stages of their education, and I try to tell them that they have to gauge their interest by getting experiences, whether it's working in the clinics or the ORs and shadowing with some faculty members at their home institution, or even community providers if they don't have a home institution ophthalmology department. And now with the advent of COVID, departments have been very creative to create other virtual opportunities in the form of grand rounds, lectures, conferences, and it's very easy for you to get involved in those as well. I think one of the key points in the game of ophthalmology career advising and navigation is for the student to find a specialty-specific mentor. And so it's going to be important to look for an ophthalmologist that can help kind of navigate the course with you as you go through the process. And this person can also be a research mentor, it could be a clinical mentor, or both. Next slide. The next question for the applicant is probably what's on everyone's mind now, and that is, how do I stack up against the crowd? And there's so many factors that you probably consider and that you think that program directors are considering, whether it's step 1 score, your class rank, your research accolades, unique interests, hobbies, or talents, some adversities that you faced, a supportive mentor or mentors that are going to write letters for you, and your leadership and community service. And the bottom line is that you really can't compare yourself to anyone else but yourself. And you have to just be confident in the fact that you're putting your best foot forward and putting your best application to paper and into the interview process. So it's actually a tailored approach, and you should actually consult with your advising dean with regards to how they feel they would perceive your application when reviewing the whole thing. Next slide. Now, if you feel that you're a weaker applicant, or if your advising dean feels that you're a weak applicant, then you have to actually consider ways that you can improve your odds. And there's a lot of things that you can't undo. You can't undo your step 1 score, you can't undo your class rank, but there's some things at this point that you might be able to do in terms of changing how your application is perceived. Maybe you can take step 2 CK and perform really well on that. Or maybe you have some abilities to get some time dedicated to research, and your passion for research can actually manifest through publications and meaningful contributions in that manner. Next slide. I think a lot of people have questions about step 2 CK, and I think a lot of your program directors also have a lot of questions about step 2 CK. I think some of the big questions is, should I take it? When should I take it? How important is it? How long should I prepare for it? And what if my score comes in after I submit my application? These are all fantastic questions. I can tell you that with step 1 moving to pass-fail in the future, it's a possibility that some programs will start to weigh step 2 CK a little bit heavier. This possibility, some programs might not look at step scores at all, and it's very hard to predict who's going to do what. But the bottom line is that if for this application cycle, since there are step 1 score, 3-digit scores that are going to be available, it's probably wise to think about your step 1 score and whether or not you feel like you can do better on step 2 CK. And if the answer to that question is yes, then you should absolutely take it. And when should you take it? I feel that taking it soon after your clerkships end is probably your best bet in terms of performing at the highest level, because the information from the clerkships is really fresh in your head, and you're really able to tackle a lot of those content materials that have to do with OB-GYN, family medicine, much better the sooner after you finish your clerkships. I typically recommend that students take about 3 to 5 weeks of dedicated time to study for step 2 CK, and they tend to do very well with that. And what happens if your score comes in after you submit your application? Well, it's very interesting to note that the applications are constantly being updated as you submit updates to the SF Match. And it's a matter of, when did your program of interest download your application? Was it before you submitted the update or after you submitted the update? Or when did your program actually, or does your program actually look at applications as they evolve? And that's going to vary from program to program, and it's just going to be a little bit of a chance that you have to take. Next slide. So what are some things if you can do if you feel like today is not your day for applying for ophthalmology? I think you have to ask yourself, are you ophthalmology or bust? Or are you happy in any clinical setting? And if the answer to the question is that you're ophthalmology or bust, then maybe you can consider taking a research year. This will allow you to really get to know a research mentor very well. It'll allow you to collaborate on research projects in an in-depth fashion, and I think build your application in a very valuable way. But if you're happy in any clinical setting, then maybe you can consider double applying and have ophthalmology as your primary application specialty, and then another backup, maybe neurology, internal medicine, etc. I think some important factors when thinking about taking a year off is to identify a supportive mentor with a track record of success and a research topic that stimulates you, because you want to be excited about what you're doing every day. And you can consider applying to a research fellowship. The NIH has one, the Research to Prevent Blindness has one, and even your home institution might have some sponsored student research programs. Next slide. The next thing is to work on your dean's letter, and you want to work closely with your advising dean on 3 unique characteristics and contributions. You also want to work closely to identify any errors in your clerkship narrative, so read them carefully before they're finally submitted. Next slide. And so now it's time to apply, and I think you've heard a lot of these tips already, but I'm just going to summarize them briefly. It's important to apply smart, and I think that the big message I want you to take home is ignore the rankings. This is all about you. And you want to look at your own learning styles, your career goals, and you want to find a program that suits all of those goals and your learning styles. If you're an independent learner versus a closely supervised learner, is research a big component of your career? Are you interested in pursuing a fellowship, or are you interested in being a comprehensive ophthalmologist? Are there life mentors that you can find in a said program, or career mentors that you identify with that can help shepherd you through the process of your career? How important is family and a support system being nearby? And I think your ophthalmology mentor is going to be very key to helping you identify those programs that align with the above. Next slide. That's all I have. Thanks for your attention.
Thank you so much, Dr. Alabiad. Our next speaker is Dr. Jeff Petty. He will talk about assessment of a program.
Hello, everyone. So honored to be with you. Thanks, Roxana, Prithvi, and the rest for putting this together. It's such an extraordinary program. This is probably how a lot of you feel, that it feels like you're begging at the doorstep of these all-powerful kingdoms, the programs. I certainly felt this way. I get it. But in truth, the match isn't this way. The match algorithm is actually, it's actually equivalent in a sense. You can go to the next slides. So, we ultimately have as much power as you do. We submit a rank list, you submit a rank list, and then it goes in and we end up matching along the way. And I do want you to have this kind of paradigm shift and understand this. It's an important point. Programs are really excited when you match with us. So next slide is a picture of all of the programs. We gather together in one big room in Los Angeles. We are waiting on match day. And this is what happens, at the University of Iowa when they match in their top 10. Next slide. This is Representative Keith Carter, his excitement that happens when you match. And in all seriousness, we really, really do get excited. And you are coming to us with this track record, this beautiful interview, this beautiful application. And you should be proud of what you've done to this point. We can go to next slide. The 3 points I'd really like you to remember are going to be really the following. So first of all, as you're thinking about evaluating programs, you don't need to go into crazy depth to 100% of all the programs. Wait until you start to get the interview invitations, and then you can really start doing some in-depth review. Next slide. All right, lean into bias. Every source of information really in anything is going to have bias, and I want you to be aware. That's kind of the wisdom. You're dealing in a situation where there's limited information, limited data about the program. So you want to be careful to not overvalue certain things which might be inaccurate or might be heavily biased. And so I'll take you through a few different examples of where information is, how you can learn about programs. But the more important thing is be a savvy consumer. Think about who is saying what, and that will bring you to your best outcome. And finally, just a point I want to stress, the culture of a program, that's the core of what you really want to try and find out about. Keep that as your primary goal, because ultimately this is kind of like a marriage, and you're marrying into a culture. You're not marrying into surgical numbers, or you're not marrying into a geography. As much of a culture of a family you're going to spend 4 years of your life with. So next slide. What's available for us? Mentors. Far and away the best asset and resource that you have. I recognize that all of you have opportunities for the type of mentorship. You may not have an ophthalmology program. Please do everything you can to seek out mentors. You can reach out to members of this panel. We'll connect you with people. They have your best interest at heart. They know who you are, and they'll know a subset of programs where you could do well. So next slide. Program generated content. We have websites. We're going to have virtual open houses, promotional materials. Keep in mind, we're putting our best foot forward. We want you to want to come to us. So of course, we've got a bias coming into this, but this is a really great way to get a sense of the culture of a program. Next. Program assessment tools. You're going to find some of these out there. They're a little scant on depth, but there are some common metrics that they show. Again, people have found these to be variably helpful, but again, as you're evaluating programs, this is something that can be helpful. Next. One thing I really, really like is social media. Now, again, our social media lives do not represent our real lives. Now, that's in general a truism, and it's certainly true of programs. But again, take this with a grain of salt and recognize we're putting out who we are and the culture and the type of people we are and the type of family we are. And that can be really helpful. And then you're going to find a lot of good mentors who can help you along the way if you don't have mentors in ophthalmology. In fact, go on Twitter, reach out, say, I'm an ophthalmology applicant without mentors. You'll get about 5 or 6 people across the country who are going to sign up. Next. Finally, dark web, anonymous comment sections of websites. Here's my favorite. I have a mini crush on the Colorado PD. Ooh, sounds juicy. Explain. I don't know. Just watch a couple videos of him talking about the program. And next slide. Indeed, Jeff Suhu, dear friend, I have a crush on him. He's amazing. Continuing on, we'll have to check out. I know I def have a crush on WVU PD, like not in a weird way. He's like 70, just love him. Rumor has it he's the nicest PD. I don't disagree. I bet he reminds me of the grandpa from Up. Next slide. And indeed, a little bit of the grandpa from Up, except much happier. Finally, you know, you just don't know in this next slide who's saying what. You could have a program director get on and write something about themselves or their own program, such as this situation. Next. This is the Utah program director. PD is QD dad vibes FR +1. I don't even know what that means, but I could have written that. Finally, last slide. Thank you all for joining us. Remember the following. Think of the bias in the program, in the information. We recognize there's limited information, and find out about the culture. That's the best way to serve your needs. Best of luck, and we're excited you're going to ophthalmology.
Thank you so much, Dr. Petty. Our next speaker is Dr. Misha Sayed, who's going to be talking about interviews and central scheduling.
It's always cruel to follow Jeff Petty, so I'm going to do my best to live up to the excellent presentation that he just gave. So I'd like to talk a little bit about tonight how your interviews may go as virtual interviews. It's specifically focusing on some aspects of the central scheduling system that was launched for the first time on SF Match in the last application cycle. And it's really been successful in allowing applicants and programs to have a centralized and unified location for interview information and for scheduling. So looking at this timeline, I know Dr. Mirza already pointed this out a little bit earlier on the timeline, but I just wanted to highlight the first date that interviews can be extended to applicants, which is October 18th. And then the interview period is from November 1st through January 7th. And again, all interviews will be virtual this year. And as an aside, I just want to mention, and this will be discussed in more detail with a later presentation, but there are optional applicant visits to programs, the live open houses that will be happening after the interview period is over and after programs have submitted their ranked list. So that is going to be covered, I believe, by Dr. Siatkowski in more detail. So some important new information on virtual interviews. Again, the cap is 18 interviews per applicant this year. Depending on the program, you can have an interview last for a half day, or it may be longer. And that information will be housed within the SF Match platform, which I'll show you in just a little bit here. And I want to remind everyone that the central scheduling system in SF Match will not allow for any time overlap between different program interviews. So you could potentially schedule 2 interviews in one day if those timeframes don't conflict, but if they do, you may not be able to do that. Next slide. So let's discuss how you'll get notified for an interview through SF Match. So you see here a screenshot where you are getting a system notification, and then you'll also get an email notification, and on the SF Match platform on your applicant page, you'll also get a message. This is when you log into the SF Match system on your main page. So here you can see that when you log into SF Match, you can see where the calendar page is, and that's for the interview scheduler calendar. You want to click on that under the interview scheduler tab. And then when you click on that calendar option, you will see the dates and times available for a particular program invitation. Applicants can accept, again, as many as 2 interviews on the same day. That's the max, as long as they don't overlap. So you can see all the options that a program's providing you for the interviews. Okay, next slide. And then you can click accept for the date and time that you choose. Now, you can only choose one date per program. However, options will remain open to move that date within a program until the spots are filled, in case you end up needing to choose a different date for a program. There is an option for an applicant to put themselves on a wait list for another date that may be preferred but not currently available at a program, but programs will enable that waitlist feature. It's not across the board. So you may not have the ability to join a waitlist with every program you apply to. Okay, next slide. So again, once you pick a virtual interview date option, there's confirmation that gets shown in the green there. And as a reminder, when you schedule the interview, the system will not allow you to schedule another interview if any portion conflicts with what you already have scheduled, unless you move it. Okay, let's go to the next slide, please. So I want to show this screenshot about how the video conference interview platform looks in SF Match. Now, thank goodness, over the past year, most of us have become virtual meeting gurus. So the process of virtual interviewing is hopefully not going to be nearly as daunting this year. The SF Match video conference platform uses Adobe Chime, and this was used by approximately 25 to 30% of programs for interviewing last year. There are breakout rooms and lounges or lobbies as part of this platform, and programs can opt to use different video conference platforms, such as Zoom. They won't necessarily be using the SF Match platform. And you will learn about what platform a program is using when you accept an interview from them. Just be sure that you know which platform your interviews are using ahead of time, so you can make sure that your computer's updated with the latest version of apps such as Zoom, and you're not stuck with any tech issues on the day of. Next slide. So that was a little bit about the nuts and bolts, and I want to now kind of look at overall how to maximize the virtual interview impression and experience. A lot of the other speakers tonight have touched on some of these things, and they may seem somewhat like common sense, but you know, you want to keep some basic ideas in mind. Just like in-person interviews, do your homework. You know, make sure you know about the program that you're interviewing with in detail ahead of time, and have specific questions ready about the program. A lot of programs have taken a lot of time to update their websites, particularly because we don't have live interviews. They really want applicants to learn about everything they have to offer. So make sure you use that to your best advantage. And remember to dress as you would for any interview. Make sure your environment on your screen looks professional. Check ahead of time to make sure your light is good and that there aren't any distracting elements. Make sure you don't have, you know, children, pets, anything like that running around in the background. These are things, again, that we think is obvious, but you'd be amazed. So just make sure that you have, you really have thought about all that ahead of time. And throughout the interview process, remember, this might last more than just the interview time. A lot of programs are doing resident social mixers virtually and some other kind of get-togethers around the actual interview day. So you need to make sure your best foot is being put forward through the whole process. Remember not to show the Zoom fatigue if you can help it. I also want to again emphasize that there's an opportunity to participate in a pilot program this year to incorporate some other aspects of holistic review of the application, including situational judgment testing and some other non-cognitive assessments. This information will be provided in more detail if you are applying to a program that's participating in the pilot. And the pilot, again, is being opted into by programs independently, and there's no endorsement, approval, or requirement to participate by the AAO, SF Match, or AUPO. Next slide, please. So thank you again for your time and attention, and feel free to email me specifically for any questions that you may have. And if we can go to the next slide. And this is just a reminder, if you don't already know about it, SF Match is having a webinar next week, July 14th, and they are sending a message to all Match registrants with the details and the sign-up information. And during this webinar, you'll get a lot more detail on how to navigate the SF Match system and the various tools throughout the application and interview process. Thank you all for your attention, and wishing you all the best for future success.
Thank you so much, Dr. Sayin. We will go on to our talk by Dr. Michael Sakowski.
Thank you all. I'm glad to speak to you tonight, and I think you're entering a terrific field. I am the chair at the Dean McGee Eye Institute and the program director as well, and I'd like to talk to you about some new things this year, new things in our program. Next slide. So the first thing is, you know, the PGY1 is changing. For years and years, it's been a traditional internship where you could do your PGY1 year anywhere you want at the place you wanted. You did your residency or, Hawaii or wherever, and the matches were separate. Now this year we still do have a number of programs with traditional internships, and it's just going to work just like it did in the past. The PGY1 matches through the NRMP, and the ophthalmology residency matches through the SF match. But it's been mandated that all programs have to convert to either an integrated or a joint PGY1 by July 1, 2023. And one of the important things of this new PGY1 is that it mandates 3 months of ophthalmology within it. Now, although these requirements are in effect now, because the final date for conversion is not until 2023, no programs will have any citations issued if they haven't converted yet. And if you look on the SF Match website with all the programs, it tells you exactly what type of PGY1 that they have with their program at this time. Next. So to review, the difference between joint and integrated PGY1s. A joint program means that it is administered jointly. It's part of the residency, but the boss of the program, the leader of the program, if you will, is the other department who's running it. It could be internal medicine, surgery, family medicine, in some cases pediatrics, and some programs have a transitional department. And so they're responsible for the curriculum, for the evaluations, for dealing with issues with the residents and the scheduling, et cetera. Other department that's not in the SF match, you would apply for the PGY1 in a joint program to the NRMP, and again through the SF match for your ophthalmology residency. In an integrated format, it's the ophthalmology department that actually administrates and runs the PGY1. And technically, ophthalmology directs the curriculum and has the final say for things like HR issues and vacations and schedules and things like that. Now, because the payment models for these can be complicated, it can be paid all by ophthalmology, or it could be shared paying or outside payment, et cetera. So what that means is that on an individual level, the exact type and amount of control and responsibility between ophthalmology and the other departments in the PGY1 vary from program to program. But in these cases, it's only the SF match you would need to apply to because everything is through ophthalmology. However, for practical purposes, I doubt that there's any of you that are only going to apply to integrated programs. You apply to integrated, joint, and traditional programs. So therefore, you're going to need to apply to both the NRMP and the SF match. Next slide. So although, we say it's integrated, it's run by ophthalmology, well, the truth of the matter is, we're not internists or surgeons or pediatricians. So we need a really close working relationship with other departments in the College of Medicine to do this together. And in the end, we all work together to determine what's the best schedule for your education, but also for appropriate interaction with the other departments and being a good campus citizen. Next slide. So when you're thinking about, you're looking at these different PGY1s, things you might want to consider is, how much time do I have in the wards, or how much time in the units? And the truth of the matter is you really should spend some time there. I mean, there are great, valuable educational lessons you need to learn there. How much time is there for electives? And some useful things for ophthalmologists are rheumatology, endocrinology, neurology. But neuroradiology, ophthalmology, it'd be good to do a couple of those. A really important question is, how much procedure experience do you want? How much do you want to be suturing? Do you want to do wound closures and trauma? Do you want to do technical procedures to improve your technical skills? And that's a really important question. I think there's a lot of value in that. And so I would recommend you do get some experience in that in your PGY1. There's a lot of different ways to do the ophthalmology component. Some places may have all the ophthalmology residents spend their last 3 months of the PGY1 together in ophthalmology. Others may have them split up in 3 months blocks, and some may have them do a month here and a month there. So you can look at that, what's the best for you. And also, what's the call responsibility? How is that split between ophthalmology and the other services you're gonna cover? So those are just things you can ask yourself. And there's no right answer to any of these. What fits you best? Next slide. So the other new thing, which is really truly new this year, is the concept of some live open houses. It's something new this year, and we wanted to give you the benefit of being able to interview virtually and save the time and the money and the travel hassle, but also to give you the opportunity to personally visit programs you're interested in person. So after The interviews are completed, and after all the programs submit their rank list, I think there's a 15-day period in which programs may choose to have live open houses, and you can visit as many as you would like and see what the fit is like there for you. And you don't need to submit your rank list until after this is done. So you have the real low stress environment because the programs have their rank list in. You're just kind of shopping around, and it's really a buyer's market at that point. You can attend as many open houses as you want. These will be structured to be up to 4 hours in length, and it could include one meal. You may look around the institute, the campus. You might go to different parts of the city. It should be an informational episode for you and a social episode for you to meet residents and faculty. There'll be no interviews at all. They cannot discuss their rank list or ask you anything about how you perceive their program. No coercion at all. And in fact, AUPO really wants you to report any coercive activity to them because it's supposed to be to your benefit, low stress and informational. Next slide. Again, in November, the programs will list the dates and times and open slots on the online schedule for these open houses. You only get invited if you're an interviewee, so only interviewers will get invited, and you'll sign up in December. The programs won't know which ones you've signed up for until after their rank lists are turned in. Then they'll see who's coming to the open house, and you have the 2 weeks to go through those visits, and February 1st, you turn in your rank list. Next. So I hope this is helpful to you. Thanks for your attention, and welcome to a great profession.
Thank you so much to all the speakers. We will now move on to our question and answer period, and I'm going to stop sharing, and we'll go to a gallery view. And I'd ask for Dr. Sankar and Dr. Goyal to guide us through this question and answer.
Great, thank you. It's been a pretty robust Q&A, so thank you very much to everybody for giving your thoughts and giving your questions to the Q&A session. I will say it's been we've been furiously typing away, and even then we're still in the hole. So thanks so much. One of the questions that I do want to ask Dr. I guess to the panel, but particularly maybe Dr. Kelly, in terms of the visiting student electives, what if a student cannot get a visiting elective before the application deadline, if they do it afterwards? Do you have any recommendations with that? And do you have any specific recommendation for that? And also potentially for getting letters of recommendation or in order to communicate how well they did to other programs?
Yes, there's a nice answer to that question in the frequently asked questions brochure. I think most program directors realize some of the constraints that exist in this time of COVID. And so certainly if you've been accepted for an away elective and you haven't completed it by the time that you submit your application, it's certainly reasonable to list that on your application. And I think some excellent advice came with the letter writing section that we just heard to make sure that letter writers do understand early on your interest and to ask what would be required to get a strong letter of recommendation.
Fantastic, that was great. Thank you very much, Dr. Kelly. Maybe one of our other questions is regarding where to put, frequently asked questions is where to put manuscripts which have been, just a detailed question, what manuscripts that have been submitted but not yet published in the SF match location. So I don't know if Dr. Sikowski or Dr. Quillen or Dr. Carter would like to chime in for that.
Well, I'll say, you could certainly, if something is under review, you could put it, or in press, you could put it in the publication area and just add note there. But, we'll look at that more carefully at the online form. And if there's a better place for it, we'll make that available to you in the written responses.
As a follow-up question, some of the students have asked how important is ophthalmology research specifically for the application, or if they have non-ophthalmology research, is that okay too? Dr. Sutowski, would that be okay for you to answer
Sure.
that?
I think all research is great. You know, it's not just exactly what you do. It's a surrogate for so many other things, like how hard you work with others, how well you collaborate, can you see a project through to completion. Those are all things that make a great resident. So whether it's in, you know, psychiatry or GI or whatever, I think, you know, whatever you do is a great learning experience and makes you a better candidate.
Thank you.
I would just chime in on that. I think that what Dr. Sukowski kind of really is highlighting is that the completion of a project. And I think that, you know, we recognize that some students come later to ophthalmology, but when they have a record of completing their previous research, they have good relationships, they have presented at meetings, or they have done all those things. It shows really how involved and how much they learned from those experiences.
Wonderful. Thanks. I guess one of the other questions have come up regarding, there's been a number of questions regarding prelim programs and just where to find out the most up-to-date information regarding what is an integrated versus a joint program.
But, you know, the type of program is listed on the Match website for every program. But, you know, if you want more information about what it details, just go to their website.
Yeah, I was going to say, I think the reality is this is a transition period, and programs are doing this on the fly. Some programs have it worked out and they've already have robust integrated PGY 1 years, and other programs are still thinking about what they're going to do. And so you're going to get some information on the Match site and then a lot of information on the individual program websites. But just keep in mind that we are in this transition phase where people are trying to figure out what's best for their program.
Dr. Saeed,
one thing.
Oh, go ahead. Sorry.
Go ahead. Oh, sorry. I was just going to say, you know, there is this thing, there's this like mythical Google Doc you're going to find out about. And if you don't know about it, just ask around social media, whatever, you're going to find out about it. Also know that, you know, somehow we might have access to that. So just, you know, be mindful of that. But that actually is a really helpful, you know, you're going to have those people that have this information, they're going to populate things, you know, where are the, you know, when are these open houses going to be, who's doing what, you know, again, lots of chatter. Just recognize it's a totally open forum and you can get anything.
There was a question that I think that would be good for Dr. Saeed about the SF Match process. Students were wondering, what can they update or submit after they've submitted their application? For example, can they update letters of recommendations?
Great question. So the way it works is that once you submit a document, letter of recommendation, test score, what have you, and you upload it, you cannot remove it, but you can add documents. So just make sure that you're confident in what you're sending to which program, because you can't negate that. It's out there once it's out there.
Great, thank you.
I have another question here. Any recommendations from the panel about choosing, if you have more than 3 letters of recommendation, in terms of how to choose letters of recommendation? That's always a very tough question that I get, and because no one can see them, right? And so, do you choose on geography? Do you choose on, you know, what connections that person may have, personal connections they may have to another program? How would you guys go about thinking of that?
If I may make just a couple, you're going to hear a total spectrum of opinions depending on your mentors. Just recognize your situation is unique, and you probably need to run this by a few, you know, mentors to kind of figure out what's best for you. I did put in the chat, but just, you know, be cautious about sending a 4th or even a 5th letter of recommendation on top of that. Recognize you're asking them to take extra time for you, and you better have a real reason why you're special enough to ask us to do that. And sometimes there are real reasons, right? You're an MD, PhD, and there's just something else that needs to be stated. So there are real reasons, but you better have a real reason.
I'm going to try to answer this.
Yeah.
I know it's hard to know whether or not what kind of letters they're going to be. But if you can kind of use your gut to feel how your story is going to be told and how it can be continued to be unfolded by other people who have witnessed you externally. Do your best to guess what that might look like as you try to round out your story.
I think that's a great. Oh, go ahead.
I was just going to say, sometimes this works if you have the right people. Your advisor may contact your letter writers and ask if they would let them review them, and then your advisor could say, you know, I think that letters, you know, 1, 2, and 3 would be the best for you.
Excellent. This I ask another question. So question that comes from regarding the dean's office, I think. And so what if your advisor or dean feels that you need to dual apply? How will that look on the SF match application and the ERAS application in terms of overlap?
That's a great question. And you know, it's a challenging one as well. It's one that's tricky to navigate for a lot of obvious reasons. One, you want to make sure that everyone's on board with the plan within your home institution, especially as it relates to your mentors. Your mentors ultimately want the best for you, and they want you to get a job when you're done, and they want you to feel fulfilled. And if you feel that your relationship with the mentor allows you to be open with them such that you can share those very, very intimate details about your passions for being a doctor in general and your goals, and they see eye to eye with you with regards to the plan, I think that you're in a great shape to dual apply to ophthalmology and then a second program or specialty of your choice. It's a little bit of work. It's a lot of logistics that you have to juggle. You have to get 4 letters of recommendation for ERAS for the different specialty, and then you have to have 3 letters of recommendation for ophthalmology. And they're going to have very little overlap, in my opinion, with regards to what they say and how they say it. But you might have an ophthalmology mentor who's willing to write you a letter of recommendation for neurology because they're on board with the plan that you've shared with them. And they'll write you great, robust letters for both. So I think it's a very careful decision you have to make with your advising dean and with your ophthalmology and other specialty mentor. But we've done it multiple times at the University of Miami. They've been very fortunate to match in ophthalmology, but you know, we all went on our gut feeling that there is a reasonable chance that they wouldn't match, and they'd rather have a job in July than take a year off, and that's fine.
Dr. Boyle, was there another question I think you had?
Yeah, there were some questions some students had. If they do not have a home institution, would they be allowed to do more than one away elective, or would that be frowned upon because there might be their first experience in ophthalmology? And I know that's a tougher question to answer, and there's probably no perfect answer for that, but if the panel has any suggestions.
I don't think there's any formal restriction on the number that you can do. Last year, there was a restriction just because of the COVID circumstances, but for if you don't have a home institution, I think it would be expected that you would do away rotations. You know, you'll see all kinds of different perspectives on this. From my personal perspective, I don't like to see too many ophthalmology electives. You know, I'd rather see applicants use their limited elective time to do a variety of different things. You know, if you're ultimately going to do ophthalmology for your life, you don't want to spend your limited 4th year time doing all these ophthalmology things. So what is the magic number? That's tough, and it's different based on circumstances. You know, I think 2, especially in a situation where you don't have a home base, that's very reasonable to me. If you're doing 4 or 5, I think that's a bad decision.
I'm going to piggyback on this one, Dr. Quillen. I think that there's so many opportunities to be creative without having to do an away rotation. And, you know, a lot of the programs have virtual opportunities that you can engage in clinical exposures and didactics without necessarily being officially involved on a away rotation. But it gives you exposure to that place, and you're a familiar face and a familiar name. And that might be good enough to help you get your foot in the door as it relates to the application review process. but it also gives you an opportunity to get a sense of the culture of the place and whether it's a good fit for you.
You know, there's a question in our chat room. I want to make, and I did typed an answer to it as well. But I want to make sure you understand that programs are only allowed to offer the number of interviews that they have spots for. So if they're going to plan on interviewing, say, 40 candidates, they can only offer 40 interviews. And to do anything different is a violation of the SF match rules, and there would be some action taken against the program. So you don't have to worry about that. Of course, if they have cancellations in the interview spots, they're free to open it up to others, but only for the amount of open spots they would have. So you don't need to worry about that.
Dr. Carter, do you have any advice, looking at the personal journey that you discussed, just with, for the applicants when they look at where they are now and then going through the application process and the interview process and then hopefully matching, what would be your global advice to these wonderful applicants?
I think first they gotta make sure ophthalmology is for them. I think they need to make sure they get the information they need, either from mentors, residents, other people who have accomplished matching in ophthalmology. I think they have a home base. They need to spend some time on the department, get to know some people. Next, you got to make sure your personality matches whatever you go into. You got to make sure ophthalmology is your fit. If you think ophthalmology, if you want to be a big surgeon, I'm not sure I would put ophthalmology as a big surgical field. I mean, we do surgery, but I see some of my surgical colleagues do a lot more, and I do a lot of surgery, but not like them. So ophthalmology is a nice blend. So you got to make sure you know what you're getting into. Ophthalmology is, great for work-life balance to some of us, but then some of us sit on Zoom calls 8 o'clock at night. So I don't know. But I think for the student overall, they just need to make sure they talk to people to get a feel for what the profession is, not only during the match. Right now, they're concentrating on the match and getting in. But what is their future and what they can expect as a career and what the life is like? I think that's what's important.
To tack on to that, if I can add what Dr. Carter was talking about, not only maybe looking at your mentors and people who are already practicing ophthalmology, but also really talking to the current ophthalmology residents and fellows and really picking their brain and understanding kind of what their rationale was for going into the field. What do they like about it? What do they wish they could change? You're going to get a very open, candid, and probably close to where you are in life, perspective, which will be very valuable too.
I would also say that I think in ophthalmology, you can have many, many different types of lives. I think everyone on this call has a different day. They spend their day in a different way. We certainly share academic ophthalmology with each other, but our day-to-day is very different. And I think one of the things that I say to my students is that you can have kind of curate your own life. You can be completely a subspecialist where you don't see any other type of specialist, or you can work in a team where you're working with multiple other specialists across the center, and you can have a global career, you can have an advocacy career, you can have almost any kind of type of career that you want within ophthalmology. So I do think we're pretty lucky to be in that position.
I just want to agree with everything you said and drop in those pearls right there. That was so well done. One question that's kind of come up over and over, I'd love to get a couple short opinions from a few people, because I think there's a variety. How granular should people be, right? Include, I was an Eagle Scout, include I was, X, Y, and Z in high school versus, things that are perhaps a little more meaningful, 3 to 5. Opinions on this, because I've seen it all.
I can tell you that here's a bias I have. There's the Eagle Scout thing comes to me, it came to me so often that certain groups of people from certain parts of the country, if they weren't Eagle Scouts, I wonder about them. So But no, I think anything that's a positive light on you is good. But make sure you can talk about it. Don't put anything on your application that you can't talk about. Like, don't put down cooking if the only thing you do is grill steaks. Don't put down photography as the iPhone's your camera. Because people are going to want you to expand on this more than just taking pictures. I mean, that's it. All of us are photographers. But I think you need to put anything down there that makes you look good, that you could defend.
Yeah, I agree. I have this slogan that I tell the students: readability and glowability. So put on your application what you want the program directors or the interviewees to read about you, because anything is fair game. And you want to talk about your passions. You want to glow and light up because, as everyone has said, and we're all here, we want to get to know you. I already look at all of you students as colleagues and future people that I would love to work with. And I want to get to know you, trust you with my patients. And so if you think readability and glowability, that is going to help you narrow down all your accomplishments. What do you really want to put on that application?
One thing I'd like to piggyback on that, I don't know how many of you guys that send in interviews and ask the student, tell me about yourself, and how fast the student gets to medical school. And I always stop them. I said, how about your family? How about the people who really got you here and supported you? You didn't give them any credit. You all of a sudden you're talking about some chemistry professor. That's because their lives are so focused at this stage that that's all they can really talk about. And you have to be able to talk about more than that. So shock us and tell us more than, you know, where you went to medical school and about your last rotation. We pretty much have all that information in your application. Tell us something different.
Well, these have all been wonderful pearls. I'm going to take a moment to wrap up our session. I mean, we could go on for hours, I think, talking about how great ophthalmology is. And ultimately, you know, this journey that you are embarking, we're very, very happy to be a part of it. We're honored to be ambassadors of this very noble profession. It's a profession that at the very core of an individual's quality of life. We're really excited about your interest in our field. I want to thank all the panelists and my co-moderator, Dr. Sankar, and our Q&A support, Dr. Goyal, for their tireless and generous time and work on this webinar. I'd also like to thank our support team, all these black tiles and some pictures here. Paulina, Erica, the amazing Lisa Brown, without whom we could not have made this a possibility. I'd also like to thank our colleagues from the AAO, Sarah Page, and from the SF Mesh, Dennis, and my goodness. Dennis and Damien, I apologize. I apologize for that, for their time being here. We'd like for you to avail of the resources, the handout, and we wish you the very best in navigating this process, and we're here rooting for you. Thank you so much. And with that, I will say good night.